Violence against women and girls is one of the most pressing challenges of our time. It is not only a crime, but also a grave human rights issue and a public health concern. To address this, the Center for Public Policy Research, CPPR, with the support of US Consulate General in Chennai, carried out a year-long national study. As part of the initiative, CPPR organized multi-stakeholder workshops across 5 states in India. The states were Goa, Telangana, Kerala, Rajasthan, and Jharkhand. These dialogues in the states brought together voices from law enforcement, the judiciary, civil society, academia, local communities, and women survivors to explore how our institutions can be strengthened and how we can respond more effectively to end violence against women and girls. In Goa, more than 100 participants came together for a multi-stakeholder workshop. Representatives from the government departments such as Women and Child Development, the District Legal Services Authority, public prosecutors, and the police joined hands with the NGO and academia. The discussions highlighted the urgent need for faster justice delivery, a stronger survivor support systems, particularly through dedicated women protection officers and more active one-stop centers.
We had a pool of knowledge and we were just checking the parameters, what the institutional mechanisms are in Goa. We have a lot of helplines wherein this violence is being handled, as in 112, 1091, 1098 and other helplines also. I think all the institutions, if we go hand in hand, that is police, judiciary and other institutions go together hand in hand, the issues can be, whatever the issues are remaining, can be resolved very nicely if everybody collaborates and go with the same goal, having the sensitivity for violence against women.
In Telangana workshop, the discussions emphasized the need for decentralized institutional mechanisms with a stronger role for NGOs and self-help group-led models.
With regard to improvement of the WCD department, so more transparency and accountability has to bring, and more awareness has to be bring at the grassroots level, and also in-time budget utilization and the budget allocation has to be made for the institutional support, and also collaboration, coordination and cooperation with other departments is very much needed, and convergence review meetings has to be taken periodically, and also WCD implies a strong MIS system has to be established.
The workshop in Kerala emphasized on integrating health systems and mental health support into the institutional responses.
The first initiative to be taken up on a large scale by the government itself, by the direct Department of Health Services itself, was the Bhumika initiative, which is a domestic violence management center acting as a one-stop crisis center working within the hospital premises. There are 21 centers located in major hospitals where there is a dedicated counselor working in the Bhumika center who is looking after the services to be provided to survivors of gender-based violence against women and girls.
In the Rajasthan workshop, local leaders spoke about community-based mechanisms and the need to sensitize law enforcement agencies.
जब किसी महिला के साथ में क्राइम होता है तो एक्चुअली उसे पता नहीं होता है कि उसको कहाँ जाना है। तो हमने देखा है कि ज़्यादातर जो है जब किसी के साथ में क्राइम होता है तो या कोई डोमेस्टिक वायलेंस हुआ या कुछ हुआ, फैमिली प्रॉब्लम हुआ, तो वो सीधे उठ करके या तो थाने जाती है या फिर कोर्ट में मतलब एडवोकेट के पास जाती है। तो जबकि ये हो सकता है कि इस प्रक्रिया को मतलब यहाँ नहीं करके हम लोग अगर एक ऐसा एक मंच मिले जहाँ पर दोनों पक्ष बैठ कर के बात कर सके तो शायद जरूर हो सकता है कि उसका कुछ समाधान निकले। उसी को ध्यान में रखते हुए ये महिला सुरक्षा सलाह केंद्र शुरू किए गए, जहाँ पर महिलाएं आती हैं, अपनी बात रखती है और फिर उनकी पीड़ा जो भी है उसका समाधान क्या हो सकता है इस पर उनसे चर्चा होती है और काफ़ी सारे विकल्प उनके सामने रखे जाते हैं। तो उन विकल्पों में से एक विकल्प का महिला चुनाव करती है। तो महिला सुरक्षा सलाह केंद्र बहुत ही उद्देश्यपूर्ण है और राजस्थान में इस वक्त 246 चल रहे हैं।
In Jharkhand, the stakeholders stressed the importance of reaching rural and tribal communities through grassroots initiatives.
आदिवासी समाज में जो सबसे बड़ा गैप है कि जो लेंस है वो अभी भी एंथ्रोपोलॉजिकल लेंस है। हमें अभी भी प्रिमिटिव, बैकवर्ड, बारबेरिक समझ के हमारे लिए काम किया जाता है और हमें बचाने की कोशिश की जाती है, लेकिन ऐसा नहीं है। अगर आप हिस्टोरिकली भी देखें और जयपाल सिंह मुंडा की बातें सुने, स्पेशली कॉन्स्टिट्यूएंट असेंबली में बोले हैं कैसा है हमारे समुदाय, कैसे है हमारे लोग, ये जो गैप आ जाता है और ये गैप फिल करने के लिए जो मैकेनिज़्म बाकी लोग चूज़ करते हैं वो होता है कि वो लोग शिक्षित बाहरी लोगों को बुला के यहाँ पर ही नौकरी देते हैं, उनको रोज़गार देते हैं और वो लोग सोचते हैं कि इससे जो हमारा सिस्टम है वो ज़्यादा ताकतवर हो जाएगा, ज़्यादा शक्तिशाली हो जाएगा और हम अच्छे से फंक्शन कर पाएंगे। लेकिन आप हमें जब तक एक विक्टिम के रूप में देखोगे तब तक तो ये प्रॉब्लम कभी सॉल्व नहीं होगा।
During the state level workshops, promising institutional mechanisms and models from the USA were discussed by speakers from the US, helping the participants learn from the international models.
The one thing that India can learn when it comes to best practices from US is the accountability factor, where the police, the law enforcement, the service providers can all sort of work together to address gender-based violence. What stood out for me when it came to these conferences that I have attended, I've attended 2 conferences thus far, is the survivor-centered approach that a lot of the service providers were talking about, as well as the importance of focusing on technology and technology abuse.
Cyber safety of women and girls was a core theme discussed across the workshops.
The cyberspace is evolving at a very rapid pace, and the kind of crimes that we can see today in this space, particularly against women and girls, so changing its form, rising at a very high rate. But many reasons why we are not able to address it. One is under-reporting, not able to identify whether it is a crime or not able to understand what mechanisms or legal mechanisms we have to follow if we are victim to certain crimes. Workshops like this help bring a lot of stakeholders into one platform to discuss these kind of issues, and we are able to understand what each organization or institution is doing. Also helps in a lot of capacity building and stakeholder participation.
During the group discussions, some common themes emerged. The need for survivor-centric reforms, faster case processing, stronger cybercrime response, enhanced role of health and mental health services, and more coordinated efforts between the government institutions and community organizations. Drawing from these dialogues, CPPR has put forward a set of policy recommendations. 1. Introduce a grassroots workforce, similar to ASHA workers, called Nirbhaya Sati, to map vulnerable spots, guide women to institutional support, and assist them in accessing justice and their rights. 2. Institutionalize gender-based training for departments like Women and Child Development, Health, Police, and Judiciary, linking it to work appraisals through mandatory assessments with dedicated budgets allotted. 3. Create a state-level VAWG dashboard with unique survivor IDs to map cases and enable seamless interdepartmental data management. 4. Dedicated cyber law for combating violence against women and girls. 5. Active role of local self-government with ward-level safety committees supporting Nirbhaya Satis and NGOs for effective implementation of the programs. 6. State Women Safety Board with members from departments like Women and Child Development, Health, Police, and Judiciary, along with CSOs, gender and cyber experts for review of policies, monitoring and evaluation of state-level dashboard, training outputs and outcomes, and coordination with local self-governments.
The state institutions are the ones that reach out to maximum number of survivors. No NGO can match up to the capacity of institutions, and even as NGOs, finally these survivors have to, and as service providers, we have to navigate these institutions. And therefore, as civil society organizations, strengthening these institutional mechanisms through capacity building, through training, through changing their practices and holding them accountable is the way to go forward.
We are working on response, but we need to work on prevention as well. as far as prevention is concerned, we need to create safe spaces, safe cities and safe environment for women. For that, a sensitization and capacity building of all, including men and boys, is necessary. The second aspect is the paying attention to mental health of women who undergo any type of violence or atrocity.
The national conference in Delhi discussed the policy recommendations with a group of experts from all over India. The study and state level workshops represent not just conversations, but a collective call to action. By strengthening our institutional mechanisms, we take a step closer to building a safer and more equal society for women and girls, together for a safer tomorrow.